Hey, welcome to Increstless. I am Becky. Today I want to talk about a subject that honestly I have some very strong opinions about, and this is regarding who should have access to your healthcare information. Who should you share your health decisions with? And the idea for this video came to me from a couple of different subreddits that I follow. Do not judge me on that, by the way. Anyway, I tend to follow different subreddits on pretty much anything metabolic syndrome. So type 2 diabetes, any issues having to do with weight, bariatrics, bariatric surgeries, high blood pressure, all of those things. And then I also tend to follow some that are relevant to women in my age cohort. So, but one of the things that I see popping up very regularly is, if I'm people who are thinking about pursuing a medication or a different course of treatment, automatically it seems like a lot of people feel like, I've got to be open about this. I've got to tell people about this. I at least need to share this with, everyone in my family. I very strongly disagree with that. In the comments, there are several people who will post, like, oh, I share everything with everybody. I tell everyone what medications I'm taking and what conditions that I have, and I tell everybody about, my nutrition and my Botox injections and whatever. And, it's like, hey, if that's you, that is absolutely your choice. You have every right to do that. I have no problems with any of those things. However, I think that when you offer the information, you are also inviting the feedback. And so that's, I think, kind of what I want to focus on today. I tend to be a person who plays my cards very close to the vest, at least initially, and particularly when it comes to aspects of health. When it comes to emotional boundaries, we're talking about that invisible force field that we all have around us. And the thing with that invisible force field is that it protects us, right? So certain information can go out, but certain information also stays in. And for me anyway, that's something I feel very, very strongly about. I've always been a very private person when it comes to my health, believe it or not, now that I have a YouTube channel that focuses on metabolic health and everything that goes along with it. But I do tend to be very private about those things, at least initially. And as I said, a big reason for that is because I know there's going to be feedback. And some of that feedback can be really good and helpful. Some of it might be indifferent. And then there's also going to be feedback that could be, just downright hostile. And honestly, I'm not interested in feedback from everybody. Oversharing is something that I think a lot of us do from time to time. And, oversharing is when we disclose too much personal information for either the relationship or the context. And I see this all the time. There are so many people who will just walk up to a perfect stranger and start telling them, everything about their lives and their kids' lives. And it's just too much. So, when it comes to my own life, there are certain things that I'm very comfortable sharing. And, I've been in higher ed for 30 years now. So I've been teaching, college students for a long time, and I love them. They are wonderful. There's nothing that I could have, in my entire life, I can't imagine anything that I would love doing more than what I am doing, and working with these amazing young people who have got so much potential. And so the subject area that I teach is human communication. And so when I teach interpersonal communication in particular, I tend to share a lot of things about my own life, a lot of my own experiences, particularly from when I was in their age cohort. So when I was in my 20s and, I was in college and graduate school and just, getting my life started, getting my career started. And, they get to hear about, places I went to school and things that I did and places I traveled. And, they get to hear about my dating life. They really enjoy that. I never use any names, but, I've got some stories to tell, and it really serves as a great opportunity for me to bond with them. And, and I'm happy to share that kind of information. However, there are many things that I would never even dream of bringing into that type of a context. When you think about, things like, your politics and your traumas and your finances, just those kinds of things. They're just things that you don't talk about in that particular context. So when it comes to things like my health, there are certain people with whom I share a lot of information early on, and those are the people in my inner circle. These people are battle tested. Right? These people have been with me for a long time, and they have proven to me over an extended period of time that I can trust them with my personal information. They're not going to go sharing it, with anybody, and when they do offer me feedback, it's going to be constructive. They may well have, ideas or recommendations or areas of expertise and, things that I had never even considered. So those are the people that I will go to right away. And once I get to the point where I am more comfortable with a situation or a diagnosis or a medication or a procedure or whatever, then I'm usually more willing to share it. But at least initially, I want time to process that information myself. And, my health decisions are between myself and my medical team. And to be very honest, when you share the information, you invite the feedback. Before I've made a decision or before I have experienced the consequences of said decision, I want that decision to be between me and my medical team. I don't want it clouded by people who may be very well intended but very ill-informed. And that happens a lot, particularly when it comes to anything having to do with metabolic dysfunction. So when it comes to issues of weight, when it comes to diabetes, prediabetes, high blood pressure, sleep apnea, anything like that. And the treatments that go along with those things, so different medications, different bariatric procedures, different types of, nutrition and movement programs and things like that. Everybody has something to say, and not all of that information is going to be good for you. So ultimately, you do you, and people are going to do what they're going to do. But I just want you to really, pump the brakes a little bit and think about who is it that you are sharing this information with, what is it that you want to get from them, and ultimately what kind of a reaction is it that you are looking for. Are you looking to, maybe get a little bit of attention? Are you, looking for, some type of constructive criticism or constructive feedback? Just really slow down, take your time, really think through it, and make sure that you're not offering more information than is appropriate to disclose at a particular time with particular people. All right. So anyway, please subscribe, leave me a comment, let me know what you think about this, and I look forward to seeing you next time. All right. Thanks for joining me. Have a great day.